Modified Bass Toothbrushing Method. Again, Modified Bass Toothbrushing Method, choose the proper toothbrush. Actually, either one of these toothbrushes would be good to use. I'm going to use the bigger one first, and then I'm going to show you how to use the circular brush. Modified Bass Toothbrushing Method is good for patients with generalized 5 to 7 millimeter pockets. You want to clean out the sulcus in that area. So 4 rows of bristles are not going to fit into a sulcus, so the best way to divide it is to place the toothbrush on the occlusal surfaces, 2 rows of bristles on the occlusal, and the other 2 into the pocket. So we're going to go like this, and it's going to slide into the pocket. When it slides in, you'll see the bristles flare and the tissues blanch. So we're creating a good 45-degree angle, similar to what we did with Modified Stillman. However, Modified Stillman is on top of the gingiva and Modified Bass is in the sulcus. Once we're in the sulcus, the vibration again is very small, but is now a back and forth vibration to the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And pick it up, place it on the next tooth over. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pick it up one tooth, place it over again. When you're on your anteriors, it would be the same way, dividing the bristles into the sulcus. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. This is cleaning out the sulcular part. We've done that, but we have to brush the teeth also. So what you want to do is finish with a rolling stroke. So you can do it 2 different ways. You can do all your sulcular cleaning and come back and do your regular rolling stroke like we already talked about, 5 times up, placing the toothbrush parallel, rolling over the gingiva and the teeth for cleaning. Or you could do a combination with the 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then pick it up, place it on top, and roll over. And kind of like the sulcular cleaning first and coming back with the rolling stroke. I think it's less complicated for most patients. If we're going to do the linguals, it would be the same way, dividing the bristles into the sulcus, back and forth. Always remember that your vibrations are very, very small. They're not gigantic back and forth strokes or gigantic circles with Modified Stillman or Bass. When you do the lower anteriors, always remember to hold the toothbrush vertically, placing the bristles into the sulcus up at a 45-degree angle, back and forth to the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then afterwards finishing up with your rolling stroke, 5 strokes across. When you do your uppers, remember everything is opposite. Now we're placing the bristles, dividing them half on the occlusal, half into the sulcus, and going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Picking it up, placing it, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and finishing with our rolling stroke, 1, 2, 3, 4, 5. Linguals would be the same way. Half and half into the sulcus, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and again finishing with your rolling stroke. Upper anterior linguals, exact same thing. In the sulcus, down, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and rolling down. Don't forget, brush your occlusals and your tongue, posterior to anterior. The other toothbrush that I wanted to show you that is also made for Modified Bass is called a sulcus brush. This is another type of toothbrush made for Modified Bass. It's called a sulcus toothbrush. Notice the difference in the bristles. There's only 2 rows of bristles versus 4 rows of bristles in a regular toothbrush. This is made for Bass. I think it's a little bit easier. If you're teaching your patient Bass, you might want to use a circular brush. You no longer have to divide the bristles on the occlusal and into the buccal or lingual surfaces. Because you have only 2 rows, you can place them into the sulcus at a 45-degree angle, creating that flaring of the bristles and blanching of the tissues. Same stroke that we did before. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Picking it up, placing it into the sulcus. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You would still complete the stroke with your rolling stroke, which you can use with this 2-rowed brush also. 3, 4, 5. So whether you're on the linguals or the buckles, it's the same motion, the back and forth small vibration motions, and always finishing up with your rolling stroke. Again, you would use the heel of the toothbrush on the lower anteriors, holding it vertically back and forth to the count of 10, and also finishing with your rolling stroke. The uppers would be the same way, only backwards, placing the bristles into the sulcus, back and forth vibration to the count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Always finishing with your rolling stroke. 1, 2, 3, 4, 5. And again, vertically on the anteriors and the linguals. Always remember, modified bass, even with the sulcular brush, you still want to brush your occlusals and you still want to brush your tongue.